Okay, we're going to look at burns now. We're looking at fairly mild burns up to more significant burns. Now we use a mnemonic to identify how serious a burn is, and the mnemonic is SCALD. And what that stands for is S stands for size of the burn. Now the size of the burn, you've probably heard in when you hear about in the press and stuff like somebody had 95% burns. That on a person's hand, including the fingers, is 1% of their body. So if you place that against the body, that's how you would be able to judge a 1% burn. So if you think somebody's got 95% burns, that's most of their body is covered in burns. Very rarely do people survive that level of burn. So why is that so important to be able to judge the size of a burn? Because anything more than a 1% burn, that casualty needs to go to hospital, okay? The only exception to that rule would be something like sunburn, mild sunburn. A mild sunburn would be just a bit of redness. But you know, occasionally you do see people that have got severe sunburn, which is you know, not just superficial, but actually partial thickness burns with lots of blistering. That's significant burn, so that's definitely, they'd be going to hospital. Now, on the subject of sunburn, there are many different causes of burns. To give you an example, sunburn is obviously one, so ultraviolet rays, electrical burns, obviously within the industry that you're in, electrical burns is important. The important thing with an electrical burn is if you ever treat a casualty that's been electrocuted, you need to make sure it's safe for you to approach that casualty. Also, think they'll have an entry wound and an exit wound with an electrical burn, and think about the damage that's done internally as well as externally. So you'll see an injury site at the entry point and exit point. Think about what it's doing internally. Other kinds of burns, causes of burns, are scalds with water, latent heat where they've touched something that's very hot. It could be a chemical burn. So chemical burns you've got to be particularly careful with. Protocols have changed quite slightly with chemical burns more recently, but with a chemical burn, if you're treating somebody with a chemical burn, you need to be, I generally would double glove as a first aider. It's better if you're wearing eye protection of some sort. Now I normally wear glasses, but definitely wearing a long sleeve top because of the risk when you treat the burn, which is with cool running water and your lots of it, you don't want it splashing back onto your skin and burning you. So it's always better to wear long sleeve tops when you're dealing with a casualty with a chemical burn. Now, if the chemical is on their clothing, generally you remove clothing, but not if it's a chemical burn. You cut it off because you don't want them pulling that chemical impregnated clothing over their head, because obviously the head is the face, the mouth and nose. So cut the clothing off rather than leaving it on them. Age of the casualties is important as part of SCALD. So we've got S for size, C for cause, A is for age. Very young children and babies have got very soft skin, so they're more susceptible to burns. And on the flip side of that, you've got very old people are more prone to infections. So again, the results of them being burnt is far more serious, certainly long term. L is for location. Now there's certain locations on your body where you definitely would not want to get burned. And it's funny, when I ask this question of guys, they all know where I'm referring to. But basically the genitalia, you would not want to get burnt there. Hands and feet are another location you don't want to get burned. Why? Because you're using them all the time. And the other obvious places, anything that affects your breathing. Now that would be your mouth, your nose, your chest, okay? Now there are going to be some pictures I'm going to show you as part of this presentation which will demonstrate certain types of burns, and one particularly to the chest. Anything that affects those areas should be taken to hospital. Depending on the severity of the burn, we'll decide whether you need to call an ambulance or not. But again, as I said earlier, with ambulances, they do have the ability to give pain relief. Anything that's going to affect breathing, that needs to be an ambulance. Get them to hospital as soon as possible, so I would be calling 999. Depths of burns. Now we don't use the terms first, second and third degree anymore, that's all gone. So we have superficial, which is another word for shallow, so that's something I've never been accused of, is being superficial. So it's a shallow burn. What does a shallow burn look like? It looks like sunburn, bit of redness. Intermediate or partial thickness burn, that's the next layer of skin has been damaged. That generally looks like you've got blistering. Now what do we not do with the blisters? We don't pop them. We leave them intact, because if you pop them, they're opening up to the air and possible infection. But the blisters are there to protect the burn. so don't pop them. Other things that you might get with an intermediate, a medium, you'll get a lot of pain. There'll be a lot of pain associated with that. The worst kind of burn you can then get is a full thickness burn. Now, what does a full thickness burn look like? It looks like, imagine if you've ever barbecued and you put sausages on a barbecue without pricking them first and they burst open. That's what a full thickness burn looks like on a person's limb. So if they've burnt themselves on the limb will literally pop open like a burst sausage. It may look charcoaly, so it's been burnt. So again, when you burn sausages on a barbecue, they get all charcoaly. That's very similar to what a human limb would look like if they've received a full thickness burn. Now, something that's a bit unique with a full thickness burn, you do not get pain associated with it. You might get it around the periphery of the burn, but actually on the burn itself, there's no pain. And the reason for that is because the nerves have been destroyed. So if somebody's presenting a burn to you that looks burst open or charcoaly looking, and they say, it doesn't hurt, it's all right, I'm fine, it doesn't hurt, that should be big alarm bells ringing for you as a first aider. That's telling you that's a full thickness burn. They need to go to hospital and get that treated ASAP. Now, how do you treat a burn per se? Now, again, the guidelines changed recently. It used to be 10 minutes and 20 minutes, and you used to do this, do that. Now it's across the board, 20 minutes treatment for any burn. Now, the best form of treatment you've got is cool running water. So how do you get cool running water? If you've got a mixer tap, just so that it's nice and cool, not ice cold, because it'll be difficult for you to put your limb under there for 20 minutes and keep it under there. If you've got no mixer tap and it's just a cold tap, you might be a case of just in and out with your hand or the arm to the affected part of the body, okay? But 20 minutes minimum. Once you've done that, you might want to consider removing jewellery. Why? Because burnt parts of limbs swell. So when it starts to swell, if you've got jewellery on, whether it be a watch, rings or whatever, it could then start to cause problems with your circulation. And it's better to take it off before the swelling takes place, because quite often if people don't take rings off, and again, one of the pictures in the presentation is of somebody's hand, you can see the band where the ring was. So take it off before it starts to swell. That way it reduces the risk of it causing problems for circulation, i.e. acting like a tourniquet. And then the last treatment, we don't put standard dressings on burns because they stick to the burn. Because when you burn yourself, you get this clear fluid comes out, which is called plasma. It's very sticky and gloopy. So we put cling film on the actual injured area. So basically at home, most people have got a roll of cling film. Pull the first couple of rolls off, cut it off so you've got sterile cling film, and then you pull it out, cut a strip of it off, lay it on top of the burn to cover the burn, to protect it from infection and to keep all the fluids in, keep it nice and moist, and then take them off to hospital, okay? When do you take somebody to hospital? Any of the areas that I've said, burns that go all the way around a limb, any of the like genitals, hands, feet, face, anything that affects breathing, take them to hospital. Anything more than a 1% burn goes to hospital, with the exception of a mild sunburn. Other than that, if you're not sure, if it's a child, take him to hospital. Always err on the side of caution. Thank you.